Public health is defined by the World Health Organization as the art and science of preventing disease, prolonging life, and promoting health through the organized efforts of society. But what really is public health? We've spent the last 4 years trying to define for ourselves what public health is, and throughout this time, we found it more complex than the WHO definition. This word cloud shows what we have defined as some of the most important aspects of what makes up this field for us. Some highlights include medicine, determinants of health, policy, education, community, environment, socioeconomic status, and social support. And in our opinion, any good definition of public health has to center on social justice. However, social justice is more complex as well. We have defined social justice as the equal and equitable opportunity for all people to self-actualize, regardless of the systems and structures in which we live. The importance of social justice and the determinants that affect the well-being of an individual can be seen in this adapted version of The Gardener's Tale, originally done by Dr. Jones. 2 seeds of the same flower are planted. One is planted in new, freshly tilled soil. The sun is shining on the new seed, giving it the opportunity to grow. This represents the overarching role of privilege in the individual's life. The seed develops firmly grounded roots, giving it a solid foundation to thrive. These roots represent education, power, social support, and a high socioeconomic status. These are all factors that allow the individual an array of opportunities to prosper in life. This strong foundation allows the flower to fully bloom. We show this through the petals that represent the outcome for these individuals. These include stable jobs, healthcare access, and stable housing. Finally, the water can references the resources that this individual has available to them to maintain their way of life. The other is planted in rocky soil. Here, clouds have blocked the sun and it rarely rains, preventing the plant's full ability to flourish, just as discrimination does to the individual. It struggles to build the same network and has to fight through the rocky soil to make a small fraction of the progress. We show this by using the roots to represent food deserts, low socioeconomic status, and unsafe neighborhoods, and the rocks for lack of resources. The petals in this story droop and grow to be mental health issues, trauma, and limited access to healthcare and educational resources. The difference between these 2 flowers shows the importance of having equal and equitable opportunities, as disparities in resources or backgrounds results in dramatically different outcomes.
Public health is multidisciplinary in nature, which means it involves several different academic disciplines or areas of focus to approach a problem.
Social justice is necessary to enact change. The following are some examples of entities at the forefront of enacting change in St. Louis. This illustration of the different approaches to helping enact change is reflective of our individual multidisciplinary approaches to public health. Here's how.
My minor in biology has helped me better understand the scientific context of public health issues, and my minor in urban poverty studies has helped me understand how social determinants of health can greatly impact populations.
Along with public health, I've concentrated on Spanish and global immersion so I can better serve the specific health needs of the Spanish-speaking population in a culturally competent and respectful way.
My minors in biology and urban poverty studies help to inform my understanding of health at both the individual and communal level in order to better understand the intricacies of health and health disparity.
I have a minor in women and gender studies and have worked for kids in underprivileged backgrounds so that I can more effectively understand and interact with people of all identities and backgrounds.
I chose a pre-physician assistant pathway because as a public health major, I want to help people struggling with mental health on an individual and a community scale.
What we have learned will guide us to think about every situation and person as holistically as possible in a collaborative effort of our individual abilities.